A new healthcare showdown is on the horizon, and this time, President Donald Trump is pushing to rewrite how Americans pay for coverage. According to three sources familiar with internal discussions, Trump intends to unveil a fresh healthcare cost proposal as early as Monday. The move comes as his administration scrambles to prevent a sharp jump in insurance premiums, a spike expected after the expiration of key Affordable Care Act. ACA, subsidies that currently help nearly 22 million people afford coverage. The plan, insiders say, is an effort by Trump to make good on his long-standing promise to produce what he calls a superior alternative to the Biden-era expansion of ACA subsidies. The timing couldn't be more charged. Democrats have already rejected attempts to reopen the government without a clean extension of those payments, leading to a month-long standoff in Washington. In a fragile compromise, Senate Republicans agreed to hold a vote in mid-December on extending the subsidies beyond this year's deadline. In return, they secured funding to keep the government running through January. That deal has now spurred Trump's team to craft its own counterproposal, aiming to reframe the debate around healthcare costs while presenting Republicans as proactive problem solvers. The original subsidy boost, approved in 2021 under President Biden, was part of a major COVID-19 relief package. But here's where it gets controversial. If the subsidies disappear, average premiums could more than double within months, according to new projections from the nonpartisan KFF. Meanwhile, the Congressional Budget Office warns that around 2 million more Americans could find themselves without insurance next year. Democrats plan to weaponize those numbers in the next election cycle, revisiting a familiar playbook that helped them retake the House in 2018 after GOP efforts to dismantle Obamacare. So what exactly is Trump's team planning? According to sources, the new proposal isn't finalized and might still shift before its release. A White House official was quick to tamp down speculation, noting that until the president speaks directly, all reports are simply conjecture. Still, media outlet MS Now first broke the story that a public rollout could come as soon as this Monday. The framework under discussion appears to combine short-term continuation of ACA subsidies with new limitations to reshape who qualifies and how much support they receive. Proposed changes could include reinstating an income cap, previously set at 400% of the federal poverty level, and requiring every enrollee to contribute at least a small premium. These rules would respond to long-standing Republican criticisms that zero premium plans are open to abuse, especially by brokers enrolling consumers without their consent. Consider this. Many low-income Americans currently pay nothing out of pocket for ACA coverage, a feature praised by progressives but now under scrutiny for allegedly fostering fraudulent enrollments by agents chasing commissions. Reinstating minimal premiums, Trump's allies argue, could dramatically reduce such misuse while encouraging greater accountability in the system. Another element sparking debate involves giving consumers more direct control over federal assistance. The proposal would likely let participants who choose lower-tier health plans redirect part of their government subsidies into personal health savings accounts, HSAs. Trump himself has repeatedly pushed for this approach, arguing that individuals, not insurance companies, should decide how to spend federal health dollars. GOP Senators Rick Scott and Bill Cassidy have already introduced related ideas. Scott's version would allow enrollees to use the full amount of their aid to buy cheaper, non-ACA plans, a move critics warn could seriously weaken Obamacare's stability. Cassidy's plan, more moderate in scope, would transfer enhanced subsidies into HSAs specifically for medical expenses like doctor visits, prescriptions, or eyeglasses. Think tanks such as the Paragon Health Institute have floated even broader reforms, proposing that cost-sharing subsidies, which lower deductibles and out-of-pocket costs for low-income Americans, also be redirected to HSAs. Advocates argue this would give patients more control over their money while pressing Congress to reauthorize funding to reduce premiums across the board. Other conservative talking points, such as expanding access to non-ACA health plans, could also find their way into Trump's draft. And in a separate but related political move, Trump is expected to call on Congress to legally enshrine his so-called most favored nation policy on drug pricing, an initiative that links U.S. medication costs to those paid in peer nations, theoretically pressuring pharmaceutical companies to lower prices domestically. So far, no one knows exactly which version of the plan will reach the public. But one thing is certain. With healthcare costs climbing and another election season approaching, this debate is destined to ignite partisan fire yet again. Will Trump's proposal represent meaningful reform, or simply reignite the old Obamacare wars under a new name? What do you think? Are stricter limits and personal accounts the answer, or a step backward? Let's hear your take in the comments.